Alright, so this video is going to be about limiting infusion volume for fluid. So limiting fluid infusion volume. So the question says, we're going to limit our patient's total intake to 3,000 mils a day, infuse primary fluids continuously when IV piggybacks are not infusing. And then our IV piggyback order is Rocephin 1 gram and 50 mils normal saline to infuse over 30 minutes QID, which is 4 times a day. And it wants us to figure out what the primary rate is. So what I do for these problems is just set yourself up like a little table-ish. And so we're going to start with the piggyback rate, piggyback volume, piggyback time. And we're going to figure those out. Then we will come over here and do primary volume, primary time, and primary rate. So you always start out with your piggyback rate and you end with your primary rate. So the way that we're going to calculate or figure these numbers out is going to be 1, 2, 3, 4, 5, 6. And so this just kind of helps us get our, like, the steps in our head, where to start and how we're going to get what they're asking for. So first is the piggyback rate. And it tells us that they are going to be infusing their piggyback 50 mils over 30 minutes. So if you just do quick math in your head, that's 100 mils an hour. So you just multiply, because since you have to multiply 30 minutes by 2 to get 60 minutes. So then you just multiply 50 mils by 2. So our piggyback rate is going to be 100 mils an hour. Then our volume is for the entire day. So when we figure out our volume, we have to take into account that it is 4 times a day. So it's 50 mils QID. So we'll do 50 times 4, which gives us 200 mils total piggyback. And so that's going to be our piggyback volume. And then we're going to figure out our piggyback time. And it's the same concept as with volume. So we're going to take the total time for each infusion is 30 minutes, but it's QID. So we're going to do 30 times 4. And that gives us 120 minutes or 2 hours. So now we have all of our piggyback stuff figured out. It'll be really easy to figure out our primary. And the piggyback stuff all just comes from the problem. You just have to make sure you take into account if they're saying QID, BID, whatever, and how many minutes in mils they're asking for the piggyback. So now we're going to come over here and we're going to figure out our primary volume. So we're going to limit the patient's total intake to 3,000 mils. But we have to remember that 200 of the mils are going to be the the piggyback volume. So we're going to subtract 200 from our total. And that gives us 2,800 mils. That will be the primary IV. So we'll put that right there. And now, same thing for our time. We are going to take our total time, which is just, it says per day. So our total time is 24 hours. And then we just calculated that our piggyback is going to take 2 hours. So we're going to subtract that. And so our primary infusion will be going for 22 hours out of the day. Now that we have that, it is super easy. We just want to figure out the rate, which IV rates are mils per hour. And so we're going to do 2,800 mils over 22 hours. And once we calculate that in our calculator, it should be 127.3 or 127 mils per hour, depending on how they tell you to round. This question didn't specify, but on your test it should be specified whether to round to the 10th, the whole number, the 100th, whatever. And so that is it. If you remember to just write out piggyback rate, piggyback volume, piggyback time, primary volume, primary time, primary rate, and work it in that order. These are super straightforward problems to do.